Welcome back. Well, more warnings again this week about younger people becoming more prone to strokes and how lives are affected hugely by such attacks. Normally a stroke is caused usually by a blood clot in the brain or when a vein in your brain bursts. That causes damage to the brain and then the way that it operates. Dr Dimakatso Makwela is a neurologist at the Maxeke Academic Hospital. Dr Makwela, good afternoon to you and thank you for your time. Firstly, how can you know when someone you're with is suddenly suffering from a stroke? How do they behave?
So a stroke means that a certain part of your brain has lost its function. So there's a couple of things that we're trying to alert the public about that they can think what's happening, maybe a stroke, and that when they see those signs, they need to rush to the nearest hospital that can treat a stroke urgently for confirmation, because on their own, and a whole lot of times we find that people think maybe it's this or the other thing, and they don't rush to hospitals as early as they should be. We use the acronyms of FAST and BFAST, and each letter stands for symptoms of what could be indicative of a stroke. The B being balance and a loss of balance. The E for eyes, loss of vision in one eye or even double vision. The F being for face, and face that's drooping or is weak on the one side or mouth turning to the one side. The A standing for arm, which means arm or leg weakness or even numbness. And the S being the speech, when a person suddenly loses the ability to speak, they cannot find the words, they try over and over again, can't find words, or their words are all jumbled up or slurred and it's difficult to understand what they're saying. All of those could be indicative of a stroke happening, and note that none of them include feeling any form of pain. It could be just numbness, loss of balance, loss of vision or double vision, weakness in the arm or leg, and even a loss of speech. And the last letter there being time that you really need to get as fast as you can to a hospital that can treat a stroke acutely.
What does a hospital actually do then if you're suffering from a stroke?
So we need to confirm, first of all, that this is a stroke, because there are other things that can do similar things to a person. But when you arrive and we activate what on our side called a stroke pathway, we have to make sure that the person receives urgent CT scanning to make sure that we are understanding of that they are having a stroke and it's a stroke that we can treat. So we activate a pathway where from the emergency unit, in fact, starting with the emergency medical services or ambulances, we need to be informed before the person arrives. We make sure that radiology can receive the patient straight from triage. We have to do a quick history and clinical examination, get a fast CT scan, and decide whether or not this is a ischemic stroke, because there are different types of strokes. With ischemic strokes, there's acute treatment that can be done to reverse disability that may be coming from that stroke, if we do get a chance to do that within 4.5 hours.
Okay, and then, when the damage to the brain has been done, can you reverse any of it? And I know people I know who've suffered a stroke, it's often the way in which they talk that's really affected.
So it all just depends on which part of the brain was affected by the stroke. So obviously certain regions of the brain serve a certain function. There can be strokes that are even silent just because they are not in a region that controls the speech or power in the arms or legs or even feelings. So some of them can even go unnoticed and you may not know. In some instances, a stroke happens and all you lose is just part of your peripheral vision. And you may not even be aware until you're driving and you realize, oh, hang on, you can't see through the mirror or traffic coming on the one side of your peripheral vision. So when the stroke has happened and unfortunately the person arrives, or it's one that cannot be treated as an acute stroke with acute intervention, the reversal really just depends on how large that stroke was and what the pre-stroke health of your brain was, or of your total body, because all of that goes into how much recovery you will get. and how fast the recovery is. So it can be that you're left with spasticity and weakness on a limb, or even the speech itself, if it was part of the stroke, or even the vision and loss of peripheral vision, like I am explaining. Or in some people, recovery becomes almost as if nothing has ever happened to them. But unfortunately, in some people, strokes can be as large as to result in death. So it all just depends on how healthy the brain and the whole body was before, how large the stroke was, and what the kind of care the person has received after suffering the stroke was. And all of those factors go into how much recovery you get post-stroke.
How do you know if you're at risk of suffering from a stroke? I mean, is there anything that sort of is obvious that actually this person or that person does need to be quite careful?
So stroke is largely secondary to cardiovascular health. So the same risks for a heart attack are going to give you a stroke. So if you have high blood pressure, and you may not know that you have high blood pressure unless you are checking. So these become silent killers: high blood pressure, diabetes, cholesterol. All of these are traditional cardiovascular risk factors. Together, they account for a majority of strokes. And in combination with even things like sedentary lifestyle and lack of exercise, heavy alcohol consumption, smoking, and even vaping that people think is safer than cigarette smoking or tobacco smoking, that also has been found to be associated with cardiovascular risk. So these are the risks that tell you that you need to look after your health better. And unless you are checking for these silent killers, you wouldn't know until there is some major event such as a heart attack or a stroke. On top of that, the other risks a person can't really do anything about, like your age. As we get older, our body ages. There is even naturally occurring atherosclerotic disease. We can't do anything about that. We can't change the fact of other medical conditions that may lead to a stroke. As a person has a cancer, or a pregnancy, for example, and even a postpartum period, it makes your blood more clotty, hypercoagulable, it's called. There are certain medication you may be taking for a different illness that are going to make you more hypercoagulable. There's even naturally occurring diseases that are like in the autoimmune spectrum, such as lupus and the other stuff. They make the blood clot easier. Having migraines also increases your risk of stroke. Having maybe congenital heart disease or heart valve disease increases the risk of stroke. Those kind of risks, nobody can do anything about it. And they are certainly the risks that explain why even a child may end up with a stroke. Even a neonate can end up with a stroke. However, the vast majority of stroke, over 80% of strokes, are related to risks that are modifiable, that people can do something about. The smoking, the alcohol, taking drugs, illicit drugs, obesity, high blood pressure, diabetes, and all of that is why essentially even younger people can have strokes.
So, I mean, on young people, are you seeing more younger people having strokes now? I mean, lifestyles have changed dramatically. Is that maybe one of the reasons?
100%, yes, there is a whole lot more younger people with strokes. And it's very devastating because the younger you are with a stroke, the harder the effect of that stroke on life is. I mean, stroke is an expensive disease. You lose your income. You've lost income because of a disability. Now you need a lot of care, medical care, rehabilitation services. Those can also be expensive with medication and all of that. So it results in a big economic burden on the person and their family once a stroke happens. But unfortunately, the lifestyle is that these traditional risk factors that are modifiable, that people can do something about, are happening in much earlier ages than in the past. The food that we eat is different from, and lifestyle is so much more different from what it used to be. Stress and depression also contributes to this, and modern life, stress and depression, I mean, life is just very stressful, much more than it used to be. So all of these factors and other exposures in the environment are such that strokes and accelerated atherosclerotic disease happens in much earlier ages. And yes, definitely you do have with do have strokes happening in earlier ages.
Dr. Makwela, is there anything you can do to reduce the chances of having a stroke? I mean, obviously you can exercise, you can stop drinking alcohol, you can stop smoking, things like that. Is there anything you can take? Is there anything else you should do?
So the biggest thing is to keep having regular medical checkups, since the high blood pressure may be silent, and then one day a stroke happens and the patient arrives in hospital with blood pressures of systolic over 240, when on average your blood pressure should be systolic 120. So it can even be that you've been walking around with blood pressures that high and you don't know. And when it causes a bit of a headache, the person takes a tablet. So unless we're checking, we wouldn't know. We need to have regular medical screenings where we do cholesterol testing, we check the glucose as well, and we do blood pressure checks. HIV is also a big contributory factor, especially in younger individuals with strokes. That also needs to be regularly checked and made sure if any of those are found that you control them, and you control them the best that can be done. What we find a lot of times is people will take treatment for a bit of time and after a while they stop their treatment. So those there, we strongly discourage that a person will just on their own say, oh, I feel fine, I don't need to be on treatment anymore. And more than that is to make sure we start increasing fruit and vegetable in the diet, improve our diet so that we have less processed food, which increase salt intakes. All of these processed food, processed meats, and whatever have a much higher salt component, and that results in a heavy salt intake, which leads to high blood pressure, and then the cascade following that. Improve exercise and walking, just brisk walking. People don't need to be in places where they think they need money to get into, but a walk around the block and brisk walking is important that we can try and do more of. Spend less time on screens. In fact, as the more you get out, the more you improve even your mental health, which also is a contributory factor. So it's all just in general, just improving heart health. And when we improve heart health, we improve brain health. And after a stroke has happened, we don't stop there as well. Even then, we're saying, because the stroke happens because of these factors that we've spoken about, we need to carry on controlling them, because when we don't, it leads to more strokes in the same person. So even after a stroke, there still needs to be concerted effort to modify and improve cardiovascular and heart health, and even take a little bit more to try and prevent more stroke, because the chance of an extra stroke in one who's had one stroke increases even higher. Once you have one stroke, your chances of another one is even higher.
Dr. Dimakatso Makwela, I really do appreciate that time. Thank you very much indeed. A neurologist at the Maxeke Hospital.